We're off, right?
We're off.
Nahid Dolsani is a palliative care doctor, but his patients aren't in hospitals and clinics. Rather, they're in shelters or drop-in centers. His small roster of patients are some of the city's homeless.
When you're socially isolated on the streets, who's advocating for you?
Dolsani dispenses much-needed health care to a vulnerable and marginalized population, many at the end of their lives. His first stop, a palliative care hospice.
Andy, how are you feeling today?
He's checking in on Andy Thomas. Now 43, Thomas is near death from metastatic bladder cancer. Dolsani and his team were able to secure a bed here, where, in all likelihood, Thomas will spend the remaining days of his life. If you weren't here, Andy, where would you be?
Oh, the streets. Easily on the streets. There's nowhere else.
You're really strong, Andy.
Well.
Yeah. Hang in there, okay?
His family most likely is us at this point.
Yeah.
And that's why today's visit was so important. It wasn't just a check-in. It was family. It was people he's known and built bridges with, bonds with, relationships with over time.
From the hospice, Dolsani heads to a shelter in Toronto's East End.
So we're headed to Wood Green Community Services to meet a gentleman who is 63 years old.
Mickey Senison has lived on the streets for most of his life and has struggled with substance abuse. He's given up the drugs, but not the alcohol. Senison is slowly dying, and Dolsani is trying to make the experience less stressful.
Palliative care is not a place, it's an approach. We're trying to bring it to you here. We're trying to give you the opportunity to feel as good as you can given what's going on.
Like I said to you earlier, I woke up and the rest of the day is going to be gravy.
Yeah.
Most Canadians would prefer to die at home, says Dolsani. The homeless and the vulnerably housed are no different. Cass Rusi, CBC News, Toronto.